Our good friend, Dr. Ted Carr, was supposed to moderate this panel today. Unfortunately, approximately a month ago, he and his wife were tragically killed by a drunk driver. And it's with a great deal of humility, honor, and sadness that I've been asked to step into shoes that are impossible for myself or anyone to fill. Ted was an inspiration to all of us and still remains so. And this keynote today is dedicated in his honor and in his memory. And as Ted would say, that's fine, Lee. Now go on. Let's get the show on the road. This year in America, over the summer, there will be 2 published reports by 2 separate federal governmental agencies that will report an incredible increase in the prevalence of autism in the United States. We've been in touch with both of these agencies, and we've been dialoguing with them quite extensively. And though the numbers are unofficial and can't be reported until they are published in peer-reviewed journals, as they should be, we have reason to believe, from what we've been told, that the new prevalence rates in the United States will be, as what we've been reporting for about the last 2 years, will be at least 1 in 100, if not higher. This is a huge growth in the number of people living with autism, and today, the systems we have in place do not adequately serve people with autism. This is most prevalent in adult services. In my beginning opening remarks, I said we had to be transformational. What does it mean to be transformational? Transforming means that you strive for new levels of fearlessness, innovation, passion, and creativity. When this process of transformation is done, you have fundamentally changed and are completely different. Transformational change can only occur when the existing set of ideas that create order and stability no longer work. What we have today in autism services in the United States, these services and support are not working. To be transformational means to not accept the way autism is being served now. To be transformational means you challenge the conventional wisdom and sometimes even the evidence to ensure impact is real, impact is scalable, and that impact is accessible to all. Our community demands it. Our community deserves it. We know enough today about autism to treat everyone and ensure a better quality of life today, but only a very small percentage are receiving these valuable services. We firmly believe there is enough evidence-based knowledge out there today. Knowing is not the issue. Knowing how to serve and support people with autism is no longer the issue. Making that knowledge accessible and delivering on that knowledge is what needs to happen today. What does the Autism Society see as the future of autism? This is what autism should look like in 20 years. We have identification of autism by 12 months of age, if not earlier. We have interventions and treatments at the time of identification that focus on the whole body and the whole life. We have every younger sibling of a person with autism in early intervention because we know that up to 50% of younger siblings will have some developmental issues. We have comprehensive educational plans from preschool through high school that foster the greatest skill development. We have, by the time that they graduate from these educational institutions, an expectation by society that our people will have a job or get a degree. We have options available that ensure that everyone with autism will have the ability to be working and living independently. This is transformational change. Today's society is missing out on what individuals with autism can contribute, and this has created a huge void. The many systems required to effectively serve our population need to work comprehensively, systematically, and seamlessly. If we join together today, use the knowledge delivered to the very few to benefit the many, we will have people that contribute significantly to their communities and to society. And that is what we at the Autism Society believe is the future of autism. Several of the systems serving the autism community are represented here today on this panel, and we have invited them to join with us as we discuss the future. Dr. Tom Insel, Director of the National Institutes of Mental Health, informed us yesterday that he would be unable to attend. In his absence, Dr. Martha Herbert has graciously agreed to discuss research in autism. Dr. Herbert is a pediatric neurologist at Massachusetts General Hospital, assistant professor of neurology at Harvard Medical School, and the Autism Society's director of treatment-guided research. Sitting next to Martha is Dr. Judith Palfrey, and she is the president of the American Academy of Pediatrics and the T. Barry Brazelton Professor of Pediatrics at Harvard Medical School, and a strong advocate for children. Next is Dr. Kathy Pratt, and she is the director of the Indiana Resource Center for Autism at the Indiana Institute on Disability and Community, and it's located at Indiana University, and she is also the Autism Society's National Board Chair. Next is Dr. Mark Freelander, who is here from Aetna, where he had joined Aetna Insurance in 2008, and he is their medical director for Aetna's behavioral health. He is currently responsible for oversight of patient management processes and design and implementation of disease management programs, including an autism resource management pilot program. Personally, I've had the pleasure of working with Dr. Freelander, and his organization struggles to do the right thing to help our families receive coverage for their children with autism. And I think that their efforts have been monumental and that they will have great success in the near future to actually achieve those ends. Last but certainly not least is Dr. Stephen Shore, and he is a professor of education at Adelphi University and a member of the Autism Society Board of Directors. Stephen is also a self-advocate. In addition to working with children and talking about life on the autism spectrum, Stephen presents and consults internationally. He probably has more miles than this room combined. And he presents all over the world on adult issues pertinent to education, relationships, employment advocacy, and disclosure. Each panelist will give a short presentation before we begin our discussion. And we're going to begin right now with Dr. Martha Herbert.